Shots may hurt a little, but the diseases they can prevent can hurt a lot more. Immunization shots, or vaccinations, are essential. Chances are you never had diphtheria. You probably don't know anyone who has suffered from this disease either. In fact, you may not know what diphtheria even is. Likewise, diseases like whooping cough, also known as pertussis, measles, mumps, and rubella may be unfamiliar to you. Years ago, these illnesses were household names, killed thousands of people in the United States each year, and they mostly killed children. Today, they are all but forgotten. That change happened largely because of immunizations. Chances are you've been vaccinated against diphtheria. You may even have been exposed to the bacterium that causes it, so the immunization you took prepared your body to fight off the disease so quickly that you were unaware of the infection. Immunizations are important for adults as well as for children. Here's why. Your immune system helps your body fight germs by producing substances to combat them. Once it does, the immune system remembers the germ and can fight it again. Vaccines contain germs that have been killed or weakened. When given to a healthy person, the vaccine triggers the immune system to respond and thus build immunity. Without your immune system, the simplest illness, even the common cold, could quickly turn deadly. Certain microbes are so powerful or virulent that they can overwhelm or escape your body's natural defenses. In those situations, vaccines can make all the difference. Before vaccines, people became immune only by actually getting a disease and surviving it. Immunizations are an easier and less risky way to become immune. There are several benefits to getting vaccinated. Vaccines protect not only yourself, but others around you. If your vaccine-primed immune system stops an illness before it starts, you will be contagious for a much shorter period of time, or perhaps not at all. Similarly, when other people are vaccinated, they are less likely to give the disease to you. Vaccines protect not only individuals, but entire communities. That is why vaccines are vital to the public health goal of preventing diseases. If a critical number of people within a community are vaccinated against a particular disease, the entire group becomes less likely to get the disease. This protection is called community or herd immunity. On the other hand, if too many people in a community do not get vaccinations, diseases can reappear. For example, in 1989, low vaccination rates allowed a measles outbreak to occur in the United States. The outbreak resulted in more than 55,000 cases of measles and 136 measles-associated deaths. If your child misses a shot, you don't need to start over. Just go back to your doctor for the next shot. The doctor will help you keep your child up to date on his or her vaccinations. The CDC has great tools online for parents to use if they're confused as to where their child or children should be with their immunizations. You can make a schedule for your child or help catch them up. You can even take a quiz to see what they may be missing. Spanish versions are also available online. Some adults incorrectly assume that the vaccines they received as children will protect them from the rest of their lives. Generally, this is true, except that some adults were never vaccinated as children. Also, newer vaccines were not available when some adults were children. Immunity can begin to fade over time, and as we age, we become more susceptible to serious disease caused by common infections. For example, the flu and pneumonia. Therefore, consult the Adult Vaccine Preventable Disease page on the CDC website to learn more about each disease. It includes a short description, symptoms, complications, transmission, and whether or not you need the vaccine as an adult. And here's information for the traveler. There's a checklist you should use, and here's some of the questions that you may ask. Have you scheduled a visit to your doctor or travel medicine provider? Are you aware of which types of vaccinations you or those traveling with you may need? Do you have altered immunocompetence due to illnesses such as diabetes or HIV? Are you pregnant or breastfeeding? Are you traveling with infants or children? If you haven't looked up any of this information before you travel, you should do so now. In summary, there are 10 things you need to know about immunizations. The first thing you need to know is why everyone should be immunized. Children need immunizations to protect them from dangerous childhood diseases. These diseases can have serious complications and even kill children. The same goes for everyone. 2. Know the diseases that childhood and adult vaccines prevent. 3. Know the number of doses that you may need. Some vaccinations require more than one visit to the doctor or healthcare provider. 4. Like any medicine, there may be minor side effects. Side effects can occur with any medicine, including vaccines. Depending on the vaccine, these can include slight fever, rash, soreness at the site of injection. Slight discomfort is normal and should not be a cause for alarm. Your healthcare provider can give you additional information. 5. You should know it's extremely rare, but vaccines can cause serious reactions. Weigh the risk. Serious reactions to vaccines are extremely rare. The risk of serious disease from not vaccinating are far greater than the risk of serious reaction to a vaccination. 6. What to do if there is a serious reaction. If someone or yourself has experienced a persistent or severe reaction, call the doctor or get to one right away. Write down what happened and the date and time it happened. Ask the doctor, nurse, or health department to file a vaccine adverse event report form or go to www.vaers.hhs.gov to file this form yourself electronically. 7. Know why you should not wait to vaccinate. Children under 5 are especially susceptible to disease because their immune systems have not built up the necessary defenses to fight infections. By immunizing on time, by age 2, you can protect children from disease and also protect others at school or daycare. 8. Be sure to track shots via a health record. A vaccination health record helps you and your healthcare provider keep vaccinations on schedule. If you move or change providers, having an accurate record might prevent repeating vaccinations already taken. A shot record should be started when a first vaccination is received and updated with each vaccination visit. 9. Some people are eligible for free vaccinations. A federal program called Vaccines for Children provides free vaccines to eligible children, including those without health insurance coverage, all those who are enrolled in Medicaid, American Indians, Alaskan Natives, and those whose health insurance dues does not cover vaccines and go to federally qualified health clinics or rural health centers. Also, the last thing you need to know is that there is more information available. For more information, call toll-free 1-800-CDC-INFO, that's 1-800-232-46